Thank you, Acting President. And today I rise in support of the Children and Health Legislation Amendment, Statement of Recognition, Aboriginal Self-Determination and Other Matters Bill 2023. Before I speak on this bill, I'd like to acknowledge that today we stand and meet on the land of the Wurundjeri people, the Kulin Nation and traditional custodians of this land. I'd like to acknowledge the Burrarung people of my electorate, the Southern Metropolitan, and the Woiwurrung people of whose land we meet today. I pay my respects to the Wurundjeri, Burrarung and Woiwurrung elders past and present, and extend my respects to the elders of the future. And I extend my respects to any First Nations people present in the chamber or joining us remotely today. It is the First Nations people of Australia, the longest continuous civilisation on earth, who we have carved for this land and who continue to maintain their culture through song and story. The Andrews Labor government is a government of truth and compassion, and that's why we are committed to truth, treaty and voice. It is because of this that we are listening to the statement from the heart. It is because of this we are committed to closing the gap national agreement to reduce the over-representation of Aboriginal and Torres Strait Islanders children in custody by 45% by 2031, but also to close the gap between the wellbeing, health, education, justice and countless more areas. President, historical treatment of the Aboriginal and Torres Strait Islanders people is a tragedy felt to this day in Aboriginal and Torres Strait Islander communities. Therefore, it is essential to work towards reconciliation. The overall objective of this legislation is clear. Our government, the Andrews Labor government, is committed to Aboriginal self-determination, and for this to be substantial, it must be embedded in our legislative framework. And that means updating our ways of operating, whether that be the Social Services Regulation, Reportable Conduct Scheme, Children's Court, Commission for Children and Young People, and more. It is the right thing to do. We have the duty to ensure that every single Victorian has the best quality of life, the best opportunities, access to the best of everything. We have a duty to ensure that we are not discriminated against or disadvantaged on the colour of their skin or any other factors. The injustices are systemic, they are complex and they are serious. Today we hope to address one aspect of this, the over-representation of our Aboriginal and Torres Strait Islander children in social services. Evidence given to the Yurruk Justice Commission has recently met has highlighted important issues. The reality is that there are an over-representation of Indigenous children and young people in the system. That is why the bill we progress key elements to address these issues. It will update several pieces of legislation to be embedded with binding principles of recognition and measures to include legislative support for Aboriginal self-determination. It is the responsibility of everyone in this and the other place to ensure that every single Aboriginal and Torres Strait Islander person in Victoria has the best opportunity in life. Self-determination is a major factor in the improvement of Aboriginal wellbeing and health. This has been known since the 1987-1991 Royal Commission into Aboriginal Deaths in Custody, along with the 1997 Bring Them Home report. In 2005, we saw legislative establishment of these principles being enshrined and protected in law through Section 12 of the Child, Youth and Families Act. It is now time to update this and other pieces of legislation to further embed our government's commitment to ensuring Aboriginal and Torres Strait Islanders self-determination. This bill will ensure that Aboriginal and Torres Strait Islanders self-determination is written into legislation. Self-determination is a basic human right, free will, the ability to decide what to do with your life. Unfortunately, many systemic forces interfere with First Nations people's self-determination and have done so for a long time. This bill seeks to firstly recognise this, recognise the hardship Aboriginal children and adults face every day, and it is a key election promise of the Andrews Labor government, and we lower the disproportionate numbers of Aboriginal children in the system. I'm proud to be part of a government that makes promises and then keeps them. Aboriginal and Torres Strait Islanders people make up 3% of the Victorian population. However, 21% of the children and young people in child protection are Aboriginal or Torres Strait Islanders. The bill follows and listens to strategies and commitments of the Aboriginal Children and Family Agreement from 2018, a tripartite agreement between the Aboriginal community, the Victorian Government and the Child and Family Services sector. It sets out 5 clear objectives to ensure Aboriginal self-determination in the child and family sector. encourage Aboriginal children and families to be strong in culture and proud of their unique identity, resource and support Aboriginal organisations to care for Aboriginal children, families and communities, commit to culturally competent and culturally safe services for staff, children and families, capture and share and build Aboriginal knowledge, learning and evidence to inform practices, prioritise Aboriginal workforce capability. Acting President, this bill aims to strengthen families, and that's what this bill, in accordance with the agreement, hopes to ensure. Strong families from Aboriginal Victorians with strong connections to culture and country. The Andrews Labor government believes deeply in this agreement and since 2018 has committed $160 million of investment into its implementation and initiatives. One of the key aspects of the bill is that it puts decision-making about Aboriginal children back in the hands of Aboriginal communities. A DFFH report has showed that 56% of Aboriginal and Torres Strait Islander children were placed in the care of non-Aboriginal or Torres Strait Islanders care. The same report found that more than half of these children were separated from their siblings. With the implementation of Aboriginal children in Aboriginal care, Aboriginal community-controlled organisations now hold responsibility for Aboriginal children's case management and plans. Additionally, a more focused approach in kinship care will ensure that higher rates of children in care are placed with family members like grandparents, aunts or uncles. This will ensure that children and young people will remain connected to their family and community. The Andrews Labor government has listened to experts through this bill. We know that Aboriginal and Torres Strait Islanders children and young people achieve better outcomes when Aboriginal or Torres Strait Islanders organisations are involved in the decision-making for their children and young people. To this effect, the bill will open the doors and make it easy for Aboriginal and Torres Strait Islanders organisations and community groups to engage in information sharing for cases of certain children and young people. This puts decision-making back in the hands of Aboriginal communities and expands the functions of such organisations to be more effective in supporting their community. Under the First Nation Community Protection Rural Pilot, Aboriginal-led agencies are authorised to undertake investigations into child protection. This means that reports and responses to protect the needs of Aboriginal children are led by Aboriginal organisations, therefore sensitive and informed on the details of the situation. Aboriginal children in Aboriginal care also authorises Aboriginal controlled community organisations with full responsibility, case planning and management of Aboriginal children under protection orders. Under Section 18 of the Child, Youth and Families Act, Aboriginal community controlled organisations may become an approved principal officer and undertake child protection functions for Aboriginal children and the young. An important detail within the bill is the enshrinement of all the 5 elements of the Aboriginal Child Placement Principle. These 5 principles are vital in ensuring that the devastating consequences resulting from the removal of Aboriginal children from their families and communities are legislated against. These principles draw on the strength of recognition, the importance of self-determination through the implementation of practical principles. They are as follows: prevention, protecting Aboriginal children's right to grow up in the family, community and culture by preemptively addressing the causes of intervention; partnership, ensuring that the participation of the community voices in the design of placement programs and case decisions; placement, placing Aboriginal children in out of home care in accordance with the appropriate placement hierarchy; participation, ensuring the participation of children, parents and family in decisions that affect the care and protection of children; connection, maintaining and supporting the connection between child and their family as they navigate out of home care. These principles work to protect Aboriginal children in they ensure that the removal of any Aboriginal children or young person is absolutely the last resort. Furthermore, if a last resort scenario is unavoidable, the Aboriginal Child Placement Principle exists to safeguard future procedures. In that First Nations welfare organisations are consulted with, and that if removal is necessary, children will be placed with extended family. If that is not possible within the Aboriginal community, the closest proximity to the child's natural family. Currently, there is some legislation that has been the potential to cause confusion. The Children, Youth and Families Act 2005, Section 13, outlines the placement principle of the 5 elements within the Aboriginal Child Placement Principle. There is no legislative detail or mention of the other 4. This leaves the impression that often the only approach or most important when considering Aboriginal placement. This bill seeks to expressly include the other 4 principles in the Child, Youth and Families Act: prevention, participation, partnership and connection. It will ensure that the placement is, in a legal sense, only ever seen as a last resort. To avoid the scenario in where a child will be removed from their family, will establish the family preservation and reunification response, a model that seeks to, where possible, keep vulnerable children and families together and support children in care returning to their homes safely. With other initiatives like the Care Hub trial and Home Stretch program, more power and personalisation will be given to those navigating the system and even altering the ways in which children and young people are able to approach family reunification. The Care Hub trial, which with assessment and planning will ensure that first-time children and young people in care will have placement, stability and a potential safe passageway home. The Home Stretch program, which will prioritise the voices and input of those who have real-life experiences and children and family systems where designing services and delivery, will ensure that the care system is designed for the people going through it. And Acting President, I note my electoral officer was one of on the board who helped deliver this program. So our office is well informed of the importance of what this legislation means. The Children, Youth and Families Act will also be amended to hold an updated definition of Aboriginal person, removing the use of an outdated and racist term. Our legislation has no place for offensive language. The bill also seeks to enshrine Aboriginal self-determination in our health legislation as per the Victorian Government's Self-Determination Reform Framework. The Health and Services Act 1988 and Public Health and Wellbeing Act 2008 will be amended to include a statement of recognition. This will be accompanied by the principles of self-determination. Additionally, it will serve to acknowledge the historical and continuous impact that laws with racist motives have had on Aboriginal and Torres Strait Islander people in Victoria. The impacts that has had on these practices and policies, and therefore the impact that this has had on the health and wellbeing of Aboriginal people. The bill recognises the importance of Aboriginal community-controlled health organisations and will also seek to share core principles of Aboriginal self-determination with health organisations so that all necessary bodies within the state may adequately informed on issues relating to their patients and clients. Additionally, the bill will ensure the power of the Commission and children and young people to advocate for children and young people in child protection and care systems. Children and young people in protection and care systems will now have the means by which to report abuse and neglect. They will have support in understanding and exercising their rights to raise concerns over issues. The advocacy function will help to ensure an easier and happier experience for children and young people in extremely vulnerable situations. Amendments will be made to the Reportable Conduct Scheme, which falls under the oversight of the Commission for Young People since its commencement in July 2017. It exists to protect children from abuse and misconduct while in the care of protection and care entities. It will alter the definition of employees so that the scheme may extend to those who are directly in contact with the children in the care of the system, such as labour hire arrangements or secondments. The Commission will give the powers to monitor and enforce compliance with requirements. In conjunction with Victoria Police, the Commissioner for Children and Young People will be able to commence proceedings under the Act. The timeframe for commencement of proceedings will be extended to 3 years, with a requirement to notify the Commission about allegations of reportable behaviour. Additionally, within the judicial system, amendments under the Children, Youth and Families Act 2005 and the Magistrates Court Act 1989 will be amended to allow the Children's Court, where appropriate, delegate certain powers of registrars and magistrates to judicial registrars. They will also be enabled to perform any functions under the registrar. This is all for the purpose of ensuring a smooth, more efficient Children's Court, so that action on emergencies situations can be quick and not traumatic for the children. This legislation is important to ensuring that Aboriginal and Torres Strait Islander children are protected, but also their connection to culture and country is protected. To enshrine these principles into legislation is to enshrine recognition into Victoria, so that we can protect their safety whilst ensuring the self-determination of every single last Aboriginal child in this state, and that they will always have a connection to the culture and country. I commend these amendments to the House.